Mr. President, I'm glad I got to be here and hear Senator Scott talk about that family and that hero and those who protect and defend us. You know, in Missouri, we've had over the last year a number of challenges on this front, and I was recently meeting with a group of African-American pastors, one of whom was from a pastor in Ferguson, Missouri, and talking about the hard work of being in law enforcement. He said, you know, people who protect us, just like me, want to go home at the end of the day. And more than most of us, people that protect us leave every day with them and their families having the number one focus, get home at the end of the day. And thank God they are willing to step forward and protect us and also understand that this is a challenging job at a challenging time. I want to talk for a little bit, Mr. President, about veterans health care, another challenge we face right now. We just unfortunately failed to move to debate the bill that would fund these programs, the bill that would increase funding for our veterans in areas like health care and benefit claims and processing claims, medical research, technology upgrades. For whatever reason, we decided as a Senate, and I don't think for a good one, that no, we're not going to debate that bill because all of these bills somehow collectively don't spend enough money. But we've talked about that. I've talked about that earlier today. Right now, I want to talk for a few minutes about what we do need to be figuring out for our veterans. We learned a year ago that the Veterans Administration wait times were unacceptable. We learned it was likely that a number of lives have been lost, deaths had been caused because our veterans didn't get to see the doctor that they should have gotten to see. They didn't get the health care that they earned as veterans and deserved. This summer, after a year of working to make this better, we found out that the wait list of people waiting more than 30 days in the VA system to see a doctor was now 50% longer than it was last year. And I thought about that a little bit, and I thought, well, maybe it was just 50% longer than they were admitting it was last year, because one thing we found out was the wait list wasn't really reflective of the real wait list, but the kind of progress that we would hope to make, we don't appear to be making yet. And the Congress last year passed a law that would give veterans more choice. It was passed on a broad bipartisan basis. The Senate came together, the Congress came together to allow veterans to receive their health care in non-VA facilities if they couldn't get that first appointment within 30 days, or if they were more than 40 miles away from a facility. We tried with some legislation this summer to put even more definition of that. I think clearly what the Congress means is 40 miles from a facility that could do what you need to have done. If you need to have a heart stent put in, just being 40 miles from a facility where they might take your blood pressure doesn't do good enough. But we're going to continue to work to change veterans health care in a way that gives veterans more choices, I hope. And what we find out is that this last-minute care is just not acceptable. We have to continue to keep focus on this. The act that we provided will create more choices. Last week, I had really one of the best conversations I'd ever had with anybody at the Veterans Administration when I talked to the Undersecretary of Health, a new person in that job, Dr. Dave Sulkin, who spent his whole life in healthcare in the private sector, managing hospitals outside the federal government. Dr. Sulkin should know what he's doing. It certainly sounded like to me he knew what he was doing, and he understood that the kinds of things that the Congress hopes to see for our veterans at the VA system need to happen. We talked about the fact that the Congress intends for veterans' choice to mean exactly that, not ways for the Veterans Administration to find obstacles to choice, but veterans' choice. If you're already a federal government health care provider, if you take Medicare patients, you ought to be able to take veterans patients at all. There shouldn't be some long second process you have to go through to become qualified so that the veteran could see a doctor that the veteran would want to see, the veteran could go to a hospital the veteran would want to go to, particularly if the VA can't meet that need. In fact, that conversation with Dr. Sulkin was so good for a little while, I thought, well, maybe I've got the wrong number here. Possibly I've actually not called the Veterans Administration, because I've never had a conversation like that where somebody at the Veterans Administration only knew what needed to be done, but wasn't afraid to compete to get the healthcare needs of veterans met. You know, I've talked to all our veterans groups in Missouri, or many of them, certainly the two big veterans groups at their annual meeting this summer. I said, many of you have had a great experience with the VA, because there are a lot of people at the VA that want to do everything they can to serve veterans in the best possible way. But so that's not good enough. All of you need to have had the best possible experience at the VA, not necessarily the best outcome, but the best possible outcome. You know, all of our healthcare outcomes aren't what we'd want them to be, but they ought to be everything they possibly should be. Veterans shouldn't have to drive past non-VA facilities that are equally capable of providing their health care or more capable of providing their health care, and we're going to continue to work to see that that happens. Competition's a good thing. The best possible place to go for your health care is a good thing, and I want to come back to that just briefly here in a moment. Before I get there, I want to say that this week on Tuesday, I received a report that I'd asked for from the Office of the Veterans Administration Inspector General that frankly just said the allegations about what was happening at the St. Louis facility, the John Cochran facility, were absolutely true. That a number of files had been changed to indicate that the consultation had been completed before it was ever had. Now, I assume that does a lot for your performance numbers if you check the completed box before you've seen the patient, but that appears to be what was happening. We learned that there's not enough oversight there. We learned that at least one psychiatrist had received performance pay based on productivity data. The only thing wrong with the productivity data was it wasn't correct. Easy to look good if you're not backing that up, I guess, with real facts. It's not acceptable. It's unexcusable. And then we have a problem of leadership at these facilities. At that hospital, the John Cochran Hospital in St. Louis, the biggest hospital we have in our state, we've had 7 temporary directors in 2 years. 7 temporary directors in 2 years. And no matter how good some of those may have been, having 7 temporary directors is a lot like not having any director at all. If you know somebody's going to be there for 14 weeks or however long they're going to be there and know somebody else is coming, that obviously doesn't produce a good result. But this is happening. There are 30 veterans centers that don't have permanent directors today. That's about 20% of all the facilities in the country. 1 in 5 of our VA medical centers doesn't have a permanent director, and we need to do better. Supposedly the new administrator of the Veterans Administration came in because he was a great manager. So far, I don't see the results. If he needs more help from the Congress to be a great manager, we ought to figure out a way to give him more help. I believe competition is a good thing. You know, the VA should be good at, really better than anybody else at a few things. Nobody should be better than the VA at dealing with post-traumatic stress. Nobody should be better than the Veterans Administration with dealing with the results of these IED attacks, the improvised explosive device attacks. Because of that, eye injuries should be something that the VA is really good with, and nobody should be better at the VA with dealing with prosthetics or spinal cord injuries. But frankly, Mr. President, after that, as a doctor, you'd appreciate this. I really don't know after that why we would assume that the VA would be the best place to specialize in almost anything else. And if it's not the best place to go, it shouldn't be the only place to go. The VA is probably not going to be likely to be any better than places you drive by. It was good to get your heart stent put in, to take care of your cancer problem, to work with your kidneys that are failing, to get your even the basic health care of getting your blood pressure checked. Our veterans deserve more choices. There are lots of reasons that the Congress should and is concerned about the way the Veterans Administration is working. It's clearly time for the Veterans Administration to get focused not on what's good for the Veterans Administration, but what's good for veterans. We owe it to our veterans. The report I got this Tuesday unfortunately verified almost every concern that people have had, and we need to insist, Mr. President, that that be better.